in the health and wellness industry for over 30 years. And a bit about me, I've actually celebrated my 30th wedding anniversary this year also, which is exciting. I have 2 children, ages 26 and 24, both doing very well. So Vegas is my home. I was born here in 1956 and call it my home for a good reason, and it's just a wonderful place to be. But, you know, I have a huge passion. I work with my wife. We've worked together the entire 30 years. And we have a huge passion for health and wellness. There's a good reason. Do you know what the top 3 killers in America are today? Who knows what they are? Number 1 is
cancer.
Heart disease.
No, it's cancer. No, it's heart disease. Okay. If you combine, if you combine heart, if you combine strokes and heart, it's number 1. Number 2 is cancer. Number 3 is
diabetes.
No, diabetes actually is number 6. Number 3 is doctors and prescribed drugs. And so that's what's really crazy. It's like, man, I mean, there's 225,000 deaths per year from doctors and the prescribed drugs that they use. That's equivalent to 10 jumbo jets falling out of the air, out of the sky every week. Let me ask you, if 10 jets were literally falling out of the sky every week in our country, would we not be at war against that? Right. Yeah. So it's not being at war against, it's just creating an opportunity for a different approach and helping our current system to embrace everybody together to learn there's another different way, there's a different way to approach it. You know, it's like they spent, or we have spent, the country spent $4.5 trillion on healthcare last year. You can idea how much money that is? If you took that and put our educational system, you could pay for half of every American from childhood age, toddlers, adults, and elderly combined, and pay for a year of private college each and every year. Well, that's going to revolutionize education, is it not? But that same money doesn't revolutionize our health in our country. Out of the 25 top industrialized countries in the world, we're ranked number 15. So we know we're failing. The system's broken. It's not working. So we need an option. We need different ways to approach it. So in my practice, I'm a functional medicine office. What that means is that, and much like an MD, a GP, I'm trained in that way. I'm an internal chiropractic physician. And so we're doing blood chemistries. We're doing different tests. We take on understanding how the body works. But our philosophy is very different. Our goals are very different. And our tools are very different. As opposed to a medical model. What's the medical model? When you go to see a doctor, what are you seeing them for? Some type of problem, right? Diabetes, heart disease, I got a cold, I got an infection. And what's the tool?
Prescription.
Some kind of drug. And what's the goal? To get to where you don't feel it anymore. When my blood test looks better. Perfect example is diabetes. Diabetes is a condition that's treated mostly with what? What's the drug that's commonly used? Insulin. And did you know that insulin actually feeds the disease? Yeah. It will make your sugar levels better, but it will also make your fat increase in your body. When your fat increases in your body, the sugar is not as effective in getting into the cell, which is what insulin is for. So the body has to take on and need more insulin taken in the body, so you have to increase your dose of your meds. That's why it's so hard to control diabetes if all you're doing is looking at the blood sugar test result and taking the drug and not paying attention to diet. Diabetes is not a blood sugar issue. Diabetes is a food and diet issue. It's a weight issue. If you continue to work on losing your weight, your blood sugars will drop. And so that's why we take a different approach. In my office, the way we start with a patient is we do a 30-minute, comprehensive, detailed interview with that patient. When's the last time you sat down with a doctor face-to-face and spent 30 minutes with them? It doesn't happen. I look through every system.
Dr. Stokes.
In my office.
Not a medical doctor. Not a medical doctor.
Right,
and not for an internal problem.
Right.
Okay? Chiropractic is very different.
I've been there and I went through it.
Yeah.
It's phenomenal.
And so the purpose of that is for me to identify what system's not in correct balance. And then we do a very comprehensive general physical, including lean body mass, blood pressures, we do heart rate variability, and by that we can see how the body's functioning. Then we order tests, standard tests, blood chemistries, cholesterol tests, thyroid tests. We use saliva testing for hormones. It might be looking for estrogen imbalance, it might be adrenals for stress. But we take all that data, put it together, and then our tools are very different. So what do you think is the most powerful tool in preventing those top 3 killers? It's in your bag.
Food.
Exactly.
Let thy food be thy medicine.
Number one tool we use in our office is food.
Food is money.
And this has come after 30 years of practice.
Money pays for the food. Yeah.
I've been practicing for 30 years. The first 28 years, this was not number one. I talked about it, but it wasn't number one. Number one really were herbs and supplements. But now I've really learned the power of food. If every individual were really to follow a whole food, plant-based lifestyle and did that, those three killers would disappear. I'm talking about vegetables, fruits, grains, nuts and seeds, beans. Very, very powerful. But we do use other tools. We use supplements, we use herbs, essential oils. Essential oils, this mister you have here in the corner, it's, there's an oil combination called On Guard, and actually it kills all the viruses and bacteria in the room. So it's really, really powerful for a home environment. We also teach people how to remove chemicals from their homes, so we use that for cleaning as well. The Pro Adjuster. The chiropractic technology we use is actually very, very different. It's called a Pro Adjuster. And this uses an instrument to analyze and treat the spine. Allows us to not have to pop or twist or crack the spine, for those that prefer to get adjusted that way. But the computer actually analyzes every level of the spine and makes adjustments to every level, so we can do it that way as well. In our office, we also have hands-on massage therapy, tremendous therapeutic massage therapists. Then we also have functional medicine. My wife actually works with me, as I mentioned, and doing functional training. She exercises people. So we take people and we say, what's your problem? Let's cut you in half. Let's discover what the problem is. And then we were talking today, Doc, we're talking about if you have the desire, then you can make that change. But the goal is very, very different. And we use the test, standard medical test, to guide that progress as people go on. So as we're sharing through the meeting today, I'm going to pass along a bottle of peppermint. This is one of the oils we use for opening up the passageways. And the way to use this is simply to take a drop of it, one drop only, because it's very strong, and simply rub it in your hands and slowly breathe in. You'll feel the passageways open. It's also very good for alertness and also for stomach. But the oils are very, very powerful. And then inside your bag, real quick, I have the apple and I have nuts. And nuts and seeds, which have such a powerful effect upon your body. If you do this every day, take nuts and seeds in your body, will reduce the risk of all cases of death. This is a DVD on the Pro Adjuster, which is the computer we use for adjusting. And this is what we use for our for nutrition. We use whole food supplements. I do have a challenge for everybody this week. I'm going to ask everybody to take one of these groups of cards. You take it and pass it along. And I'm going to ask you to hand out, there's 3 cards there, just having one card to each individual that really is looking at something they can do to change your life. We offer free consultations. We don't charge for that. We'll take the time with them, discover what they have. If I make a recommendation and they say that, no, this is not for me, we don't charge for that. I'll send them home with something, a diet or something to support what the time they use. So we keep our entrance in the clinic very, very easy. So thank you so much for your time.
Thank you.
Dr. Craig Rolls.
Thank you very much. We have 2 minutes for questions.